So in the front of the heart, you have the right atrium, the right ventricle, the left atrium, left ventricle, or the left auricle, and the right auricle. And then you also have the ligamentum arteriosum. The top side of the heart is called the base, and the bottom, the pointed part, is called the apex. You also have the anterior intraventricular sulcus, which is the groove that goes right here, and then the coronary sulcus, which goes across between the right atrium and the right ventricle. For the arteries, we have the coronary artery. Right here is this little short piece. Off of that, you have the circumflex artery that goes around. Left anterior descending artery, also known as the anterior intraventricular artery because it goes over the anterior intraventricular sulcus. And then you have the right coronary artery, which goes down and around here. Off of that, you have the marginal artery, which is on the margin of the heart. And you have the posterior interventricular artery. And that's it. On the veins you have, on the front, you have great cardiac vein, the small cardiac vein, and you have the anterior cardiac veins, which is these little short ones that look like icicles. And then on the back, you have the coronary sinus, and you have the superior right here and inferior vena cava. You have the coronary sinus. You have the middle cardiac vein, the posterior cardiac vein, and then the left and right pulmonary veins, which is this side is the left, this side is the right pulmonary vein. They're red because they're coming back from the lungs. When you open up the heart, we already know that this is the right atrium, right ventricle, left atrium, left ventricle. So when you open up the heart, you can actually see the divisions: right atrium, right ventricle, left atrium, left ventricle. So inside the heart, you have the chordae tendineae, which is this gray part, and pulling on those muscles, you have the papillary muscles. And then in the atrium, you have the pectinate muscles. Between the ventricles, you have a wall. It's called the intraventricular septum. Okay, whenever blood comes into the heart, it comes into the right atrium, right here, which is this part right here, comes down through the tricuspid, right here, which can be seen right here. And then it goes into the right ventricle. From the right ventricle, it goes out, twists around into the pulmonary semilunar valve, which is down here, and then out through the pulmonary trunk into the pulmonary left and right pulmonary arteries. And then it goes to the lungs, comes back into the heart through into the left atrium, down through the bicuspid into the left ventricle. And then from the left ventricle, it is pushed through the aortic semilunar valve into the aorta. Aortic semilunar valve is right here into the aorta. From the posterior or dorsal side, you see here the left atrium, left ventricle, right atrium, right ventricle. So you take it apart, you can see them better. You can see the left atrium, left ventricle, right atrium, right ventricle. So blood comes into the right atrium from the body, goes through the tricuspid valve, which you can see better on this half right here, the tricuspid. And then it falls down into the right ventricle. The right ventricle pushes it out through the pulmonary trunk, which is this part right here. And you can see the pulmonary semilunar valve right here. That blue right there. Goes out to the lungs, comes back in to the left atrium, down through the bicuspid, which you can see right here, down into the left ventricle, and then is pushed from the left ventricle out through the aorta, through the aortic semilunar valve, which is this right here.